Good morning and welcome to Health Matters. My name is Lisa Gaucher. I'm a local resident from East Palo Alto and proud to be a member of the San Mateo County Board of Supervisors for District 4, which covers East Palo Alto, a portion of Menlo Park, Redwood City, Redwood Shores, and North Fair Oaks. It is great to see many of you here on a Saturday morning, and I want to say welcome. Also, I'd like to welcome those who are joining us online from around the world. Before we get started, I want to remind you that a live Q&A will follow each of this morning's presentations. We'll be accepting questions by via the QR code, which is on the back of your program, or on the screen if you're watching virtually. Today, it is my pleasure to introduce Dr. Deborah Kado. Dr. Kado is a co-director of the Stanford Center on Longevity and a professor of medicine, primary care, and population health here at Stanford. Dr. Kado will share with you how a century-long lifespan is not out of the realm of possibility for many people, and how creating vitality is something more of an art than a science. Please join me in welcoming Dr. Kado. Thank you.
Good morning, everyone. So great to see you all out here and joining us for 2025 Health Matters. And thank you to those who are joining online. I'd like to give a special shout out to family members who couldn't be here today, including my mom and dad, Paul, Sarah, Jay, and Stephen. So thank you for being here to support me in the work that I do. And I also would like to thank all of the conference organizers without whom this whole event would not be possible. So please give a hand for these people. They work months in advance, probably a year in advance, planning this. So I hope you really enjoy today's talk as well as the rest of this day. So a geriatrician is a doctor who specializes in the care of older people. They're specially trained to make sure that they can help their patients lead the most healthy lives possible for however long is what they would like. And they provide a holistic type of care, which sometimes gets forgotten in our days of increased technology and specialization down to the very cellular level. A gerontologist is someone who studies aging. They're scientists. I happen to be both. So today we're going to talk about longevity and why early habits matter. I'm going to talk about it from a scientific standpoint, providing data from studies that I have either done or have read about. I will talk about being a clinician and how my almost 35 years of practice has informed me the clinical pearls that my patients have taught me over the years to be able to share with you. So as a gerontologist, I'm fortunate enough to co-teach a course with Professor Laura Carstensen, the founder of the Stanford Longevity Center, and a course appropriately titled Longevity. And this slide is actually from that course. And we teach the students that a child born today can have a reasonable expectation to lead a century-long life. And that kind of is, so if you're 65, think about another 35 years. And when we speak to the students, especially the ones in their 20s, and we think about that, we ask them, well, if you had an extra 35 years, where would you decide to put those years? Most of them will say, maybe I'd be a child again because being in college is a little stressful. And then we also have some older students who take the course, and they all say, no, I'm not going back there. Thank you very much. Today, I'm also going to talk about some common myths, 4 common myths associated with aging, and I'd like to dispel those. So, with this increased life expectancy, along with the first baby boomers turning age 65 in 2010, of course there's been a huge increasing interest in longevity, such that some people are beginning to believe that aging is a disease, reasoning that with the increased cellular damage over time that predisposes us to developing cardiovascular disease, cancer, dementia, this is terrible. Aging is something to be avoided. In fact, Silicon Valley, investing in longevity is a serious billion-dollar-a-year business. People are working to find ways to delay, stop, reverse aging. They are also, perhaps some of them, thinking, I think we have the science, we have the technology, we can become immortal. All right, so maybe now you've had some time to look at this graph. What this graph is a survival curve. And Dr. James Fries, back in 1980, published in the New England Journal of Medicine, wow, look at life expectancy. In the second half of the 20th century, life expectancy started increasing dramatically. And this was largely due to vaccines, to having access to good food and nutrition, better sanitation, antibiotics, etc. But what he noted is, ideally, if that rectangular curve, so age is on the x-axis, going from 0 to 100, and the proportion of people surviving is going from 0 to 100%. So at the very left-hand side is when you're 0 years old and you start cracking people, virtually everybody is surviving. And what he wrote about is that there's going to be this rectangularization of that survival curve, so that more and more people are going to make it to be older and older. What he vied for at that time is, okay, that's great, but what stage of health are you during your older years? And so the blue part under that curve represents the years that one is aging healthily. And the red part of the curve is when the years that people might be disabled. And as time goes on, more and more people might be falling into that red part. So in the United States, the average age of onset of disability is about age 66. And from that time, the age of death is about 13 years. So on average, people will live with some disability for about 13 years before they pass on. So what he provided, and which I think people are doing more now, is not just thinking about living longer, they're thinking about living healthier. In fact, I would posit that many of you here are here for that reason. I want to live healthier, right? And so people talk about health span. And what health span is defined as is the years that you live healthily. And that is what people are focusing on. How can we live healthy for however long we can? And then if we have to get sick, let's have it be for a really short time before, we kick the bucket. The only problem I have with the definition of health span is that people may have different definitions of what healthy is. So sometimes they say, well, healthy in terms of free from really serious life-threatening diseases. So I'm fortunate enough to be here 2 years later, and if you came to my 2023 Health Matters talk, this picture was displayed. And I got a few gasps because both of these women are 74 years of age chronologically. And this picture was taken back in 2010. I don't know the woman on the right, but the woman on the left, I don't know if any of you might recognize her. If you're bodybuilders, you might know who she is. Her name is Geraldine Shepard. She, at age 56, decided that when she was shopping with her sister for a bathing suit in a department store, that she and her sister were not liking what they were looking at. So they made this pact. Now, we got to get to the gym. So that's what they decided to do, and they started going to the gym until, unfortunately, just a few years later, her sister suffered an untimely death from a brain aneurysm. This caused Geraldine to become very depressed, and she just kind of stopped doing that until her daughter said, you know, Mom, your sister really would have wanted you to continue to go to the gym. So she started doing that, and then by age 71, she participated in her first bodybuilding contest. And by age 74, she became the Guinness Book of World Records oldest performing female bodybuilder. And here's her picture. Okay, so 2 years later here at Health Matters, I decided to look her up. And here she is last June, just before turning the age of 88. Okay? Look at that. Pretty impressive. Now, I did look her up recently, like this week. She's looking forward to her 89th birthday, and I think if the more recent pictures, she looks about the same to me. And she teaches now bodybuilding. Okay, I am not suggesting that all of you go out there and become bodybuilders, okay? But this is where I'm gonna start talking about the myths of aging. And the first myth that I really want to dispel is to be old is to be sick. Okay, many people, including healthcare providers and scientists, tend to believe that chronological age can be a standard marker of a person's expected decline through their life course. Okay, in fact, this is not necessarily wrong in that multiple studies demonstrate, if large studies, whatever you're looking at, that age is one of the strongest predictors of any disease. Just pick one out of the hat. So cancer, cardiovascular disease, dementia, pneumonia, they're all there. They all seem to be age-related. But I can say life is just a little bit more complicated than that. Okay, so as a practicing geriatrician who has the privilege of treating a spectrum of older adults, I can say that you should not use chronological age as a metric of how someone should be expected to do. And in fact, scientific data support that from the Health and Retirement Study, the Medicare expenditure data. So if you look at this graph here, where there's chronological age on the x-axis and biological age on the y-axis, there's increased heterogeneity or variability as people get older. So that by the age of 85, and here's where the Health Retirement Study data come through, the majority report no health-based limitation. Now, I'm thinking that a lot of you would be surprised at this statistic because when you think about 85, well, that sounds pretty old. And the fact that more than half, 56%, are living independently, doing the things they need to do to live. And I think that statistic comes as a surprise to some. Now I'd also talk about health early habits and why they would matter, right? So if you look at that graph carefully, in the beginning of life, we're kind of all similar. We can't really feed ourselves. We can't really crawl or walk or talk. And that's pretty uniform. But as we get older, you know, things start to separate a little bit more. And by the time you get to be 65 plus, study after study shows that, in fact, we are so heterogeneous as a population. So whether it's vital signs such as blood pressure, temperature, heart rate, fasting blood sugar, DNA methylation clocks that are supposed to tell you your physiological age, the diversity of your gut microbiome, all of these things become more diverse as people get older. And as a practicing physician and a geriatrician, I know that among my colleagues, we have a common saying: you seen one 85-year-old, you've seen one 85-year-old. So one thing I say mentioned is that a good portion of people, the majority at age 85, are living independently and don't report any health limitations. I often ask the students in medical school and undergrad, okay, so how many people in the United States, what percentage do you think are living in nursing homes? And about 98% of the class, whether it's undergraduates or medical students, get it wrong. It's about 4%, which seems low to them, but that's what the data show. So I'm moving on to this slide to say, what if you want to avoid that 4%? What can you do starting today? So this slide is courtesy of a physical therapist, Michael John Favre, here at Stanford Healthcare. And what he has done is graphically represented what we have seen in study after study. Those people who walk faster tend to do better health-wise over time. They have decreased rates of mortality, decreased rates of physical limitations, they have better cognition, they have a better feeling of sense of self, etc. If you look at his slide, the top green part, if you walk more than 2.7 miles per hour or 1 meter per second, you're going to be independent in your activities of daily living, ADLs, which mean basically you can take care of yourself in terms of bathing, dressing, transferring within a home, feeding yourself, etc. You're going to be less likely to be hospitalized. You're going to be less likely to have an adverse event. And you can cross the street with no problems in the normal walk sign signal. At about 1 meter per second or 2.2 miles per hour, things get a little bit more shaky. This is when people may be more likely to have trouble with balance, which then puts them at risk of falls. But they're still doing pretty okay. It's really at 0.6 meters per second or 1.3 miles per hour where you see more health-based health problems, such as becoming dependent in those activities of daily living, becoming dependent in those instrumental activities of daily living, which means how I teach it is what you need to do to be able to go to college, do your own laundry, for example, get your own food. And then you're also more likely to be hospitalized. You may need more interventions in terms of walking aids, etc. So this is important. This walking is important. Okay. This allows me to move on to the second myth, which is, have you heard the myth, the horse is out of the barn? Well, I would say, just let's say you are a slow walker, okay? I'm actually not a very fast walker. And so what can you do if you're a slow walker? Is there something I can do? And what I like to teach the medical students and residents is, yes, I have great data published back in 1990 from the New England Journal of Medicine, where they enrolled 10 adults who lived in a nursing home in Boston. And they enrolled them in high-intensity interval training over a period of 8 weeks. So these people ranged from age from 87 to 96 with a mean age of 90. And they had a personal trainer come in and do these exercises. And after 8 weeks, via CT scan of their thigh muscle, it increased on average 174%. Unbelievable. Did you think you could build muscle in your 90s? Well, you can, but it takes work. They also, and maybe more important than this CT scan in the thigh muscle, is that they were walking faster. They had better stair climbing power. They were able to have better balance. So it's clear that no matter where you are in that spectrum, from very early to even very late in life, you can still have the expectation to improve. So what is high-intensity interval training? In fact, I was so surprised when I saw that 1990 paper because that was not in my lexicon at that time. It's really been over the past 10 years that I've seen these gyms pop up and people saying they're doing HIIT training. So the AARP has said that they're endorsing 5 HIIT workouts that are perfect for older adults. The first one is cycling, the second is treadmill, third is dumbbell circuit, fourth is swimming, and 5 is brisk hill walking. Okay, but unless you're a physical therapist or really an athlete, you still might say, okay, what exactly does that mean? So let me just tell you what these people who are mean age 90 were asked to do. What they were asked to do is to provide their maximum effort of their quadriceps strength. And then the trainer said, okay, That was your one-time maximal effort. Now let's just try half that much. And let's do that maybe 7 to 9 times. And then let's rest for 1 to 2 minutes. And let's then do this with several repetitions and do it 3 times a week, which they did for 8 weeks. And they got that kind of a result. I got this from the web. It's basically showing what you might get at the gym is what you can fast run on the treadmill for 30 seconds and then rest for a minute or 2 and then keep on doing it. It's the interval training part, really putting out the stress to exercise and then relax for a while, allow yourself to recover. Do it again until you feel to the point where you feel comfortable not to overdo it. Okay. So the third myth is that older people are miserable. Yeah, but it doesn't have to be that way. Okay. So as a geriatrician, some people come to me with the worries that their happiest days are behind them. I really have the good fortune of working with Professor Laura Carstensen, who really did the seminal work to dispel this myth, okay? She actually was a bit surprised when, 40 years ago, she looked at populations and she asked about social, emotional health. And what she found was that probably around 60 and above, people were just reporting that they were happier compared to younger ages. And people, when they read that study, they were so skeptical. Like, poor study design. Oh, maybe, actually, they were demented, the people in the study. They didn't remember that they're actually not healthy. Well, as a scientist, okay, my scientist hat, I would say, you always, sometimes you get unexpected findings, right? And I think even Laura herself was kind of surprised at that. But what you look for to be sure, is this a real, true finding, or was this just some kind of fluke? Is you look for repetition. Are other people, especially not just the same person, but other people kind of showing the same thing in different populations, et cetera? Then you can have more confidence. Wow, this is really a fact. So I'm going to show you some data. She herself also did further work, basically saying, okay, let's just say it is fact. Why? And you'll have to wait till another time for me to tell you. But she has done elegant experiments up through today to kind of show that this is truly a true finding. I'd like to put out here also the fact that with the pandemic and just what's been going on in the world, people have been very worried about social isolation. It's not good for us. Humans in general, we are very sociable beings. And there is this idea that as you get older, you get more socially isolated. And she's also done work to say, that is not necessarily true. What happens is people, as they get older, they get more discerning. They figure out that who do they want to spend time with. They're not going to waste time spending with, making small talk with people who don't really matter to them. They really focus on family and meaningful activities. And so if you look at the literature, actually the people who are really suffering are our younger age groups. So we really need to pay attention to our younger children, teenagers, and young adults, because things are very challenging. And they're the ones, I think, who are at highest risk of socialization, not just older people. As I think people think, oh, well, all their friends and their family die off, and that's why they're all alone. But it's interesting if you actually talk to the people who are experiencing these losses. And that's for another conversation also. So let me just show you these data from this study of 340,000 persons ages 18 to 85 from across the United States. And on the left-hand graph, you see well-being ladder, age on the x-axis by 4 age increments, and well-being self-reported on the y-axis. And interestingly enough, what you see is the nadir, or the bottom, is age 50. But from age 50 all the way to age 85, it's pretty remarkable that well-being actually seems to go up, kind of replicating, right, what Professor Carstensen showed. And when I saw this graph, it reminded me of frequent phone conversations that I have with my mother, who is in her mid-80s. think she's turning 85 this year. And she usually ends the conversation with me, well, Debbie, I just want to let you know that your best years are yet to come. So maybe what she's saying has some real valid truth to that, right? I also put, from this paper from PNAS, this graph on stress, because we know that chronic stress is not good for us. And in fact, it kind of goes back to show where the stress is, right? It's really in our younger age groups, 18 to 21 to 30. These are the high stress periods. By the time you get past age 65, you're on the downside. You're feeling less stress. Who knew? But this is what the data show us. So the fourth myth that I'd like to dispel is it's a good myth because it's kind of pithy, is that the success to successful aging is to choose your parents wisely. Now, that's a little silly, but what I think it's trying to get at is like genes are important, right? Genes are important health determinants, and we really did believe that. Actually, up through the sequencing of the human genome, which happened in about 2003, we're like, yes, we're going to find the genes that cause this disease, that disease, and then we can target it with gene therapy, and we'll all be healthy for maybe live forever, I don't know. But what we found is life is more complicated than that. That it's not just the genes, it's also the environment, it's also the behavior in which you spend your daily lives that really affect gene expression. And there is a whole new field or other field of science going on here at Stanford about epigenetics. How does the environment interact with the genes to cause changes in health, for example? So, when I put here because people who come to Health Matters want to know, what can I do, what can I do? So those are a few things on the slide that you can read about. But when I see patients, I usually focus on three things because it's hard to remember more than three things. So the first thing is, one, what matters to them? And what matters to them is different to different people. So it's really important to get that personal input from them. And then once I figure out what matters to them, then I like to highlight the agency that they actually have that they may not have known that they have. And say, okay, this is your goal, this is what matters, this is what we need to get to your goal. And then the third thing comes from, I don't say that, oh, it's all my patients tell me this, but this is actually the truth. My patients have taught me over the years, over my 35 years, that what really matters in terms of best health outcomes and outcomes for those people are having a sense of optimism, that they believe that you could actually do better. And when they believe that, that then influences their actions, that then influences the outcome. And so those are the three things that I think are really, really important. But let's just say if your health span is challenged by disability, because things happen, and you don't have control over those things. So what do you do? So I'm going to use two quick examples of some people who are pretty famous who've had some health challenges. Here's Matisse. I think most people know about Matisse. He's a famous artist. His paintings are a lot of different places. But at age 72, he developed an abdominal cancer. And he had a surgery, had the tumor taken out. But after that surgery, he was wheelchair bound. He could no longer do the floor-to-ceiling mural paintings that he used to do. So he pivoted. He started doing cutouts. And personally, his cutout work is my favorite of his artistic ability. He lived for another 13 years and passed away at age 85. The next person is Grandma Moses. Now, Grandma Moses grew up in the United States on a farm. She was very active on that farm, and one of her pastimes was needlepoint. But at age 76, she developed pretty bad arthritis of her hands, and she could no longer do that needlepoint. So again, she pivoted. She started painting. And then she became discovered at age 78, and her paintings were shown at the Museum of Modern Art in New York. And she then had a single art woman show at age 80, and she made it for another 21 years and passed away at age 101. So, if I can forward the slide. Oh, there you go. So I would encourage the entire audience, online and in person, that maybe coming out of this, you should think about what your expectations are and that they can be changed. Maybe age shouldn't be what defines you, but maybe how you live does. Thank you so much for your attention.
I should be walking faster. Let me wait.
Did you want to sit on this?
I'm going to walk faster, so that was my practice. Was that fast enough?
Yes, very good.
Okay.
But you know what? Our shoes aren't very good.
Okay, I'm going to if you see me later on the day, I'm going to be doing intervals. We're all going to be doing intervals. Thank you, Dr. Kado, so much for that inspirational talk. That was very, very helpful. I know we have audience questions, and I just want to remind everyone, if you want to submit a question, please use the QR code. How many of you looked at your watch or thought about, am I walking fast enough? Also, is there still time for me to look like the bodybuilder? That was my question. I want to know if I can do that. Okay, so the first question I see, at what age is one able to begin a patient-physician relationship with a geriatrician?
Well, if you're lucky, as early as possible, I would say. But generally, we use the age of 65. But here at Stanford, it would be 65 with health challenges.
Okay.
Yeah.
That is perfect. Next question. Can you share recommendations about diet and lifestyle practices to reduce body inflammation?
Yeah. So I'm thinking a bit about the high-intensity interval training because we think of inflammation as bad, which it is if it's unmitigated and it keeps on being high. But if you can kind of cycle, there's some positive role to inflammation also. It helps us heal, but you have to hopefully get it to cycle back down. So in terms of diet, diet studies are almost the hardest, but I think there is pretty much a general consensus that a diet full of fresh fruits and fresh vegetables, or even frozen vegetables if you don't have access, and frozen fruits if you don't have access to the fresh ones, as well as minimizing non-processed foods, will really help with inflammation overall. And interestingly enough, just getting out and taking that walk and working out and walking every day and looking at your environment and realizing the beautiful nature that's out there has amazing restorative powers. And then I bring up the third thing, which I'm not very good at, is people talk about meditation, really being mindful in the moment. And it doesn't necessarily take a lot of time because a lot of people are like, I'm too busy to do that. I have to do this and that and the other. And I'm a list maker, so I'm just saying it's not easy for me. But the idea is that you have to give the time for yourself and just take some deep breaths. I talk about diaphragmatic breathing in the clinic with my patients. I teach them how to do it. If you are a singer or a trumpet player or something, you've already got it down. But for those of us who haven't been doing that, it's not that hard to learn how to do.
So I heard walking again. Walking is important. Is there something I should be doing, or all of us should be doing, to improve our sleep? What can we do to improve our sleep?
All right, sleep is important, so I don't want to say that it's not important, because it is. It's vital, actually, to survival. But to stress about sleep is another thing. So if you're having trouble with sleep, the best therapies out there are actually cognitive behavioral therapy rather than the pills. So, and what I learned from my colleagues who are experts in sleep is really, like, if you have one sleepless night, don't sweat it. That happens. And don't worry about it. Just, maybe you're excited about giving a Health Matters talk, for example. No, just kidding. No, I slept fine last night, by the way. But the idea is, it's the chronic sleep issues. If you have those, you should seek care to get them, and it's not a simple pill. Certainly not getting sleep aids over the counter. But if you had to, melatonin is probably the safest one, but I would encourage more looking at sleep behaviors, and cognitive behavioral sleep therapy is the best way to get around it.
So I'm hearing I should turn my TV off probably earlier than I do, and I would probably sleep better. That's with that as well. Okay, the next question. Are there specific dietary patterns that have shown promise in promoting healthy aging? What about intermittent fasting?
Okay, well, there is a lot of and interest in that area. And I think in general, they show some pretty impressive results in terms of improving our metabolism and some people body weight and things like that. There is not a one size that fits all. I love eating, and so I like to eat healthy, but I don't try to obsess over hours that I'm not eating versus eating. But a lot of people do it, and a lot of people, it seems to work. A lot of people who study it also practice these things. And when I look at the data, there were some data presented at the Gerontological Society of America meeting last November, and when they looked at the different types of diets, whether it's fasting because of Ramadan, or if it's intermittent, let's not eat for 16 hours, or do it 2 days a week, or whatever it is, they all kind of showed similar benefits. So I would kind of say eat mindfully, eat healthily, and if you want to try one of those types of eating patterns, it's probably not going to hurt you. Maybe
Great.
benefit you.
Thank you. Next, we're going to talk about, can lifestyle choices overcome your genetics when it comes to healthy aging?
Oh, I'm going to talk about a study that has stuck in my mind for a long time. So Becca Levy from Yale had access to the Baltimore longitudinal aging study and collected their impressions of aging when these participants were about 30 years old. And then in the 1990s, they could do sequencing for ApoE4, which is the genetic predeterminant of developing Alzheimer's disease. And what she looked at is, of those people who developed Alzheimer's disease because they had the genetic load to develop it, what were their attitudes of aging when they were 30? And interestingly enough, she published that those who reported having better attitudes about aging when they're 30 had a 50% decreased likelihood of developing Alzheimer's disease 50 years later. So in a way, is that a lifestyle choice? Well, I think it's certainly a cognitive choice, right? So I think if you do anything and you leave today, besides walking faster or trying to walk faster, is actually maybe think about your attitudes about aging, not only of other people, but about yourself and what your self-expectations can be. Because they can be really positive, but as I tell all my patients at VA, because now I see patients at VA, it takes work. You know, it's not going to be a simple fix, but if you figure out what matters to you, and if it really matters, you can make a difference in your own life.
No, thank you. Attitude matters. How can we maintain cognitive health as we age? And are there specific activities or habits that are particularly beneficial?
Well, cognitive health. Okay. There's so many things that people can do. And the good news is it's not necessarily crossword puzzles, which, by the way, I'm not good at. I mean, if you like crossword puzzles, that's fine, but it's not enough. I'll tell you that, okay? So it's really finding things that interest you so that they can keep your attention and so that you can invest your time in something that means something to you. So I like to say, like for me, if I could have had another career, I would have been a dancer. That wasn't going to happen with my body build, but that's okay. Now if I retire, I'll probably think, I know that I don't look like a ballet dancer, but I like dancing, so I might do dancing. Or it might be some artistic expression. Maybe, all of us sitting in this room today and online have interesting life stories. Even writing down your thoughts on a daily basis helps you think. It gets you out of your, it gets you to think beyond yourself, which I think is really, really important. And so those are just two examples. There are many, many.
No, I like that. I know I like to dance like nobody's watching. I'm not the best dancer, but if music is turned on, I'm going to dance. So that may be helpful for me. Next we're going to say, are there any supplements or specific nutrients that have been shown to promote healthy aging? What can we take? Is there a magic pill? No? Okay.
Well, if you go online, you're going to find a lot of magic pills. They can cost you $60 a month or more. And famous people really believe in them. A lot of the people who've done the science behind them, which is good science, but it's usually shown in worms or mice. So You know, we who are in medicine know that any pill that you take, even a baby aspirin, can have an adverse effect. So for me, the data are not there yet to suggest that there is any particular supplement that people in general should take to age healthy. I'm sorry.
Well, thank you. I should stop shopping on some of these networks, and that's not going to work. Attitude. I have to remember it's attitude and walking fast. Okay, those are the two things. Why is maintaining physical balance such an important part of aging, and what can I do to help increase my balance?
Okay.
It's for everyone. We're going to increase our balance.
So much of my work for the past 25, 30 years has been in musculoskeletal aging, and my clinical work has been in bone health or osteoporosis. So if you don't have good balance, your risk of falling goes up exponentially. And falling in itself, if you get up and there are no injuries, okay, so it was a little to do. But if you break a bone, or you have you hit your head, all these things have longer lasting implications on your good health. So we really focus on balance as geriatricians. We look at that, we examine it in the exam room, and that's why we think it's so important. What I do with my patients is I usually ask them, and this is about the physical balance and how can you get yours to be better, is I ask them, well, my feet don't even touch the floor, but anyway, the idea is they're sitting in the chair, usually is lower, and then I just ask them to stand up from that chair without using their arms. Now, if they have to use their arms, that's okay, but we start wherever they can. And then I ask them, how do they feel? And if they feel steady, then I say, okay, where are you standing? Okay, a little like this. Okay, let's put your feet a little closer together. How are you feeling? And if they feel okay, then I ask them to do something called the semi-tandem stand, which is one foot slightly in front of the other. This is where some people start getting a little bit more uneven like that. But if they're steady, then I ask them to put one foot straight in front of the other. And if they're still doing really well, then I ask them to close their eyes. And if they still do really well, then I said, okay, stand on one foot. And if they're still doing really well, I ask them, close your eyes. And if you do it in high heels, you're even doing great.
Give her a round of applause. Look at that balance. That's amazing.
And then I say, if they mess up on any of those areas, it's okay, because you know what? I get people coming back, right? They're like, okay, let me show you how to get it up out of this chair. That's fine. And they're like, oh, I'm doing it 5 times. Look at that. And they do all these things. And so they know what to work on. So that's the very first thing. But also, if you're not someone who's used to working in your body and feel insecure that you might hurt yourself, you should ask your physician for a physical therapy recommendation or an order, or even get a personal trainer to help you build your balance and strength.
Thank you. That was great.
But you got to practice.
Right. That was impressive. You're in heels. What are the thoughts on hormone replacement therapy for women as they age past 60?
Oh, I'm so sorry that Dr. Adams is over there when I'm over here, because this is really her area in menopause and aging. But basically, what she told me actually recently was the average age of menopause in the United States had been typically about 51, but she's noticing that people are coming in later and later, reaching at about 60, right? So if we depended on studies, which the most famous and sometimes considered nefarious study is the Women's Health Initiative, which was, by the way, the study that we did need to be done, but it kind of was a setback because it showed that the things that I was prescribing in the 90s was not necessarily as good as we thought they were in terms of preventing heart disease and different diseases. So my thoughts are that if you're having hot flashes and you're going through menopause, right after menopause is probably the time to be considering hormones. But starting much beyond that, it's very questionable because the Women's Health Initiative, which had people over the age of 65 randomized to getting either estrogen and progesterone against placebo, didn't show the benefits that we were hoping to see. It's good for bone, by the way, though. That was definitely shown in WHI, and decreased risk of colon cancer. So everything is kind of a double-edged sword.
All right, well, thank you. All right, this is our last question. What role does purpose or having a sense of meaning play in healthy aging?
Oh, so important.
It's about attitude. It's about how you feel, right?
Just brings me back to this patient I had when I was still at UCLA, who I took care of his wife who had dementia, and then him, and he was 6 weeks in the intensive care unit and really had a rough go at it. And then he got up and his 6 kids came around the bed and said, "Dr. Kado, you have to tell Dad to stop eating the pork belly fat." Because now he's better. And I just realized from that patient who I took care of, I told them, he just went through basically hell. And if he wants pork belly fat, I think we should give it to him. Okay. But he had this attitude, this undying attitude. He got out, he grieved his wife terribly. We went through that. Mm-hmm. But he found another love. He survived. He went up to Mammoth. And I think it was all mostly about his attitude because he had major challenges getting better.
Well, thank you. Can you join me in just thanking Dr. Kado for this presentation today?
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.